makes you so sick at heart that you can't take part. You can't even passively take part.
There is a controversy brewing here in Mexico over the use of ivermectin by Mexico City authorities in treating COVID for quite a long period of time and apparently without patients' consent. Now, I'm bringing this up because a certain Jimmy Dore, when he appeared on Joe Rogan for the last time, mentioned Mexico as one of the countries that have been using ivermectin. So let's recap that scene.
The Joe Rogan experience.
So what about can we talk about
Yeah.
ivermectin?
Yeah, sure.
So I covered it, what they did in Mexico City, and ivermectin seems to be a drug that not only treats it, but it will prevent you from getting it.
Okay, so I recall making a video of this and mentioning that treatment that was done in Mexico City at the time, and so it kind of surprises me why the controversy just basically exploded here a couple of days ago, because from what I understood, this was well known at the time. I mean, it was published on the Mexico City Health Ministry's website. This article did the rounds. My assumption here was that ivermectin had been used as a experimental protocol, as occurred in many countries, and apparently it was a bit different than that. So here's what actually happened. So the Mexico City government at the time had set up basically kiosks around the city and was handing out these COVID kits to people who, I guess, tested positive or had symptoms. And in these COVID kits, you had numerous things like a thermometer, face masks, paracetamol, and a couple of other medications that at the time were, thought to possibly work. And one of those was ivermectin. So I'm not sure if all of these kits had the ivermectin, but apparently a significant amount of them did. I'm not sure exactly what the number was, but I think it was probably so the Mexico City government, and I want to be clear, Mexico is a federal republic, so states can set their own healthcare policies. Mexico City is kind of like Washington, D.C. It's a state. Officially, it's a state. So it has its own health ministry. It has its own. It can take actions that are not explicitly prohibited by the federal health ministry. So the city government spent 24 million pesos, which is over $1 million, in buying 293,000 ivermectin boxes, as well as these other, which at the time were neither recommended nor approved by the federal government. So this is part of the controversy, that the federal government of Mexico never ever endorsed use of ivermectin. This was a decision taken entirely by health authorities of Mexico City, not the country. And this was only distributed in Mexico City. So, when I first heard about this, what I originally thought was that it had been done if it had been given experimentally, I guess in a hospital setting, because the whole point of this was apparently also to see if the ivermectin worked, which I presume is something that you can only test reliably in a hospital setting. Or having very strict patient follow-ups, which I'm not quite sure they did. If they wanted to do a study of whether it worked, you would have had to follow up on the people who you gave those kits that had the ivermectin. So it's not clear to me how this happened. So I'm led to assume that the people who were given these kits had their details given. to the authorities at the kiosks, and I suppose that if eventually they ended up in a hospital, it would be recorded. Of course, a lot of people in Mexico died outside of hospital. That is one of the reasons why Mexico's excess deaths is one of the highest in the world, relative to the official deaths. So the Mexican death count, which already is huge, it's I think Russia just overtook us recently, but it's otherwise the fifth biggest COVID death tally in the world, and probably only countries like India have a much higher unofficial death count than Mexico. It is huge. So a lot of people died outside of hospital. A lot of people died without just any way of really knowing that they died. So you can see why it would be problematic to do a study where you're following people up after giving them this kit and then not knowing what happens to them later. So this is also problematic in a country where you don't really have, like your personal GP, where you are registered and things like that. People go to mostly like the local pharmacy will have a doctor and they'll go see them. So there's just not good enough registry of people to be able to follow them up outside of a hospital setting. So they did this, and then they subsequently made a study. And by the way, this is still up on the website. This is the Mexico City government health secretariat or ministry, however you want to call it. This is up there still. The study that was made, ivermectin and the probability of hospitalization for COVID-19. So they have a summary of the results of that study, which apparently showed a very large 68.4% percent in the odds of being hospitalized if you got the ivermectin kit. So this looks like, wow, amazing, right? Yeah, so apparently this was people who were given some form of tracking, so less than 76% reduction. Yeah, so this clearly was a study that all the horse dewormer advocates immediately saw. See, we told you it worked, except it didn't. And this study, and I think this is the reason why this controversy exploded in recent days, because again, I just found it weird. It's like this has been going on for months now. I find it really hard to understand why now this controversy is brewing here, because right now it's one of the top news items in Mexico. So on February 4th, so just a few days ago, SOC Archive, which is apparently a platform to publish medical journal articles, withdrew that study, Ivermectin and the odds of hospitalization due to COVID-19 by Marino et al. So you can confirm that it's the same one here. And the reasons were, so this is very weird. They admit that it's very rare that they take down an article after it's been published. And yeah, the paper is a report on a program in Mexico City that gave people medical kits when they tested positive for COVID-19, containing, among other things, ivermectin tablets. The conclusion of the paper is, study supports ivermectin-based interventions to assuage the effects of COVID-19 pandemic on the health system. The lead author of the paper, yada, yada, yada. We have written about this paper previously. We wrote in part, depending on which critique you prefer, the paper is either very poor quality or else deliberately false and misleading. PolitiFact debunked it here, partly based on this fact checked in Portuguese. We do not believe that it provides reliable or useful information, and we are disappointed that it has been very popular, downloaded almost 10,000 times so far, probably by Jimmy Dore and Joe Rogan fans, I'm sure. We do not have a policy to remove papers like this from our service, which meets submission criteria when we post them, but turn out to be harmful. However, we could develop one such as a petition process or some review trigger. This is an open discussion. Yeah, among our most read papers in the past year. yeah. The in response, the University of California, San Diego sociology professor Juan Pablo Pardo Guerra posted an appeal to SOC Archive asking us to remove the deeply problematic and unethical paper and ban its authors from our platform. This appeal, in a widely shared Twitter thread, argued that the authors, through their agency dispensing the medication, unethically recruited experimental subjects, apparently without informed consent, and thus the study is an unethical study. They did not declare a conflict of interest, although they are employees of agencies that carried out the policy. Now, this is clear because two of them, Olivia Lopez and Jorge Alfredo Ochoa, work for the health ministry of Mexico City. That's CEDESA. Victor Hugo Bojas works for the IMSS, that is Mexico's health care, public health care service. I would assume that this is not a conflict of interest, the IMSS, because they obviously run tons of hospitals and they do a lot of research themselves. But yeah, definitely if you work for the ministry itself, that is the administrative structure of it, then yeah, there is a pretty damn big conflict of interest. Although the thread was shared and liked by thousands of people, the article in response prompted us to revisit this paper. So yeah, so here's the main issue. It probably would not have been wrong to give these out at the time because they didn't know if it was gonna work. Like I said earlier in the pandemic, many medications were given out not knowing if they worked or not. And these would prompt subsequent studies. But yeah, you should be told that these medications are experimental and that you are part of an experiment that's being conducted. If you don't do that, then it is unethical. Otherwise, the best thing would have just been to not do that study at all and just say, well, this was public policy. We saw that there was perhaps some early evidence that these might work. We don't have any other treatments. We don't have vaccines at the time. Let's see if it worked. But then don't make a study out of it and then vindicate the policies that you as a health ministry did by using basically human guinea pigs. So yeah, this is pretty unethical. And again, I don't understand why this took so long to become a controversy. This should have been very problematic at the time, and I think there was a lot of questioning on that study. And the video that I made of this, I recall quoting a Twitter thread which explained all the problems that study had. Yeah, which I think one of the problems was they took people at different points in time. It was very convoluted. But yeah, that is the story of yet another horse dewormer journal article that has proven to be bunk, like so many others. And let me just be absolutely clear about things. Ivermectin is not proven to work against COVID. There is zero evidence that it works. Zero. Anyone saying anything other than that is lying to you. And currently, the only way we have to prevent serious COVID disease is through vaccines and through a number of new treatments that are currently being introduced but are still not widespread. Those are the only things that we have at our disposal to prevent serious illness from COVID. So if you haven't been vaccinated, which I'm sure most of the people who watch my channel already are, so I'm kind of preaching to the choir here. But yeah, get vaccinated. Get a booster if you have the chance to get one. Play your part in this crisis, and don't believe charlatans like Jimmy Dore, like Joe Rogan, who have been promoting all these scams, because they are scams for themselves, because they benefit from it. They benefit from views, they benefit from clout, they benefit from they benefit financially from it by creating this image of them being against the mainstream media and big pharma and all that bullshit. And remember, the real leftist critique about big pharma is not that what they produce doesn't work. The critique against big pharma is that they have too much power in terms of lobbying, do not serve the interests of average working people by charging outrageous prices in countries like the US, or preventing vaccines from, in the middle of a pandemic, to be distributed without intellectual property protections. Those are the leftist critiques against big pharma. The critique has never been that what they produce doesn't work. So, yep, there we go. And I should add, the Mexico City government is leftist. So I probably should make a video of how very unleftist the López Obrador government is. And, the Mexico City government is the same party as López Obrador. He was once the mayor of Mexico City. That was his first big elected office before becoming president. So, yeah, Mexico City's left has a problem with this too. So, on that note, if you like this video, please like, please share. Most importantly, please subscribe. I will see you next time.